How are ya?
Well, we're doing so well.
We've missed you.
Yeah, we missed you.
Oh, I missed you guys too.
Yeah. You heard you went well. Hope you're better now.
Yes, on the mend.
Okay. So there's a lot to cover today, so let's go straight to...
Exactly, Daniel. But just before we get straight into the newspapers and the updates on COVID-19, yesterday we were talking about funerals and how the ban on public gatherings has affected funerals. If you get into the Daily Graphic, it's an interesting story because in South Africa, we're told that funerals have become hotspots of COVID-19 infections. Funerals have become the hotspots of COVID-19 infections in South Africa. And a quote here says, we've observed a rapid rise in the number of confirmed cases from funerals. And this has raised a concern in South Africa. So, more of a reason why you probably should be, thinking of postponing your funeral.
Yes, indeed.
Or having the private burial with just 25 people.
Burial, yes.
With just 25 people. All right. So quick updates on COVID-19 here in Ghana. And we're still at 1154 total number of cases, 120 recoveries. And we know that 401 were from the general routine surveillance, 638 were recorded among the population through the Ghana Health Service enhanced surveillance activities, otherwise known as contact tracing, and with 115 cases from travelers. As at April 18th, there have been, the last death recorded was on April 18th, and the death toll still stands at 9. So that's it for Ghana. But around the world, COVID has infected more than 2.6 million people, 183,000 worldwide, worldwide dead. So 183,000 people dead, according to Johns Hopkins University, and more than 46,000 of that number have died in the United States. Staying with the United States, President Donald Trump has signed an executive order and is banning all immigration into the U.S. over the coronavirus fears. Another interesting piece of information about the coronavirus is that the United Nations has said, and they addressed, there was an address by the UN Security Council, and they have said that it's likely that the world is risking biblical famines due to the pandemic.
So the biblical famine, that's a very strong statement where nobody at all has food. You remember Prof. Stephen Adair made a statement like that. So it's important we think through saving lives and saving livelihoods, as some economists will say. But let's do the front pages now, shall we?
Exactly. So the Daily Graphic says economic growth expands from 300 billion Ghana cedis in 2018 to 349 billion in 2019. Ghana on course to hit 100,000 COVID-19 tests soon. That's according to Professor William Ampo, who's head of virology at the Noguchi Memorial Institute for Medical Research. And COVID-19 prevention directives enhanced could draw upon companies ready to deliver PPEs by mid-May, and Gofield support Takwa municipality to combat COVID-19 on the back page of the Daily Graphic, and Bank of Africa Ghana supports COVID-19 fight.
Okay, on the front page of the Daily Guide, fetish priest kills twin brother, 120 recover from COVID-19 as cases hit 1154. Christians and Muslims support Nana, U.S. military deal ruling adjourned, and COA FS FDA fight rages. And that's it for the Daily Guide.
The Business and Financial Times for today says government allays fears over efficiency of Unipa, says new system has proven track record, and oil drives GDP growth to 6.5% in 2019. Still on the front page, ECOWAS leaders hold virtual extraordinary summit to combat COVID-19 in the region today, and World Bank predicts sharpest decline of remittances in recent history. Backpage, GCB donates Veronica Barker's sanitation ministry, and Standard Chartered commits 1 million Ghana cedis towards COVID-19 relief.
All right, on the back page of the Ghanaian Times, the Greater Accra Regional Security Council has moved to enforce the wearing of face masks. Fire guts building at Kokomlemle. On the front page of the Ghanaian Times, lifting of partial lockdown. The decision was based on science, as according to President Akufo-Addo. COVID-19 National Trust Fund bags 34 million Ghana cedis. Dr. Nsia Asari dismisses fears about 15,000 projected COVID-19 deaths, and confirmed COVID-19 cases hit 1154. 54 and 120 people recover, as I have said earlier on.
Top story on myjoyonline.com. Leadership experts praise Akufo-Addo's handling of coronavirus crisis in Ghana. First man to test positive for coronavirus in Upper West region recovers, and this was in the 6 a.m. news. IGP orders 10,000 police officers to test for coronavirus. CityNewsroom.com. Commercial drivers threaten to increase fares over high fuel price. Interesting. COVID-19. 8,000 frontline police officers ordered to self-quarantine. Trust our tests. Core FS product still contaminated. FDA insists. There's a lot of controversy around Core FS and its safety. StarFM.com.gh says COVID-19. Passengers fume as STC fails to practice social distancing in buses. Tamale military prevent COVID-19 Guineans from leaving quarantine base. And the BBC says China has extended its run of no recorded virus deaths, and Tanzania warns on false hopes in COVID-19 fight. Right, it's 15 minutes to the top of the hour. Let's get straight into the stories now.
And talking about getting straight into the stories, I know quickly, because yesterday we're talking about whether we should make the wearing of nose mask mandatory. We're told that in Germany, for instance, all of Germany's states have announced the wearing of face masks that is now compulsory to combat the spread of coronavirus. So you don't have a choice. All you have to do is that you have to put on a face mask, whether you have COVID-19 or not. I think we should also consider such a thing in Ghana. But talking about issues making news, so the economy, we're told, has grown from 300 billion in 2018 to 349 billion in 2019, and that's also as a result of a bit of growth in the oil sector. The surprising thing, though, is that this is calculated using an exchange rate of 5.2 to the dollar, and you ask yourself, what would be the situation if it is calculated today? And we're told that the per capita income measured by the average income earned per person in a specified year was 11,541, or the equivalent of $2,212. The services sector still remains the largest sector with a share of GDP increasing from 46.3 in 2018 to 47.2 in 2019. So we're doing well. The economy is growing.
Yes, it's growing, but we need to know what the figures will be after this virus pandemic ends, and we see exactly where the chips fall, as they say. The online news review is brought to you by Zenith Bank, in your best interest, and Goyle Good Energy. So all our valued customers, Goyle values our relationships built over the years. Let's keep ourselves free of the coronavirus disease and keep our stations safe. Just cover your mouth with tissue when you cough and dispose of the tissue immediately. Wash your hands with soap and running water, which have been provided at all service stations, especially when you handle money. You can also use an alcohol-based sanitizer if you're not in a position to wash your hands. Maintain a minimum distance of 1.5 meters with other customers and or attendants. Let's observe these simple protocols and together defeat the COVID-19 virus. If you exhibit any symptoms, do not head to the hospital immediately. Call 055-2222-004 or 055-2222-005. Now, banking from home just got exciting. Zenith Bank has waived charges on its electronic banking platforms to support you reduce your use of physical cash during these challenging times of COVID-19. Enjoy free transfer of funds and free payments from your Zenith accounts to any bank accounts via ACH and GIPS Instant Pay GIP. Bank from the safety of your home. Stay safe with Zenith Bank's digital banking product, Zenith Bank, in your best interest. Now, I was saying earlier that we want to clear some of the questions that were raised yesterday as a result of this news conference, and especially concerning testing of cases and the data that we keep. We'll speak to Dr. Kofi Boni. He's a senior research fellow at Noguchi Memorial Institute of Medical Research. But before that, let's hear Dr. William Ampofo.
I hope that we've understood that the number of samples is approximately equal to the number of tests that are reported. There has been some discussion about the testing for the recoveries. Recoveries we have right now is 120 people. If those people have been tested 4 times, that's 480 samples or 480 tests. So the retests are insignificant compared to the total number that we've done. And actually, we have a separate database for those who have been retested. So when we provide the cumulative figures to the Ghana Health Service, it excludes those who have been retested. So I think this point should be made clear that the retesting does not affect the data that is reported. And yes, what Ghana Service is reporting is the number of individuals who are tested. Let me repeat again. Each sample is accompanied by a case investigation form for that individual. And actually, the reasons we have a backlog is that, unfortunately, due to some issues in the sample collection, we have had some samples that have had no forms. Okay? So we have not been able to report and process these particular individual samples. And we are, in some cases, we have had them to be resampled. New samples have been collected. They have been retested. So what you get from Ghana Health Service is the individual, that particular person's results.
That's Dr. William Ampofolo of Noguchi, and Dr. Kofi Boni has joined us on the line. Dr. Boni, thanks for your time this morning.
Yes, thanks also, Daniel, for the opportunity.
So we just heard Dr. Ampofolo say that then the data provided by Ghana Health Service represents individuals. So just to be clear, does that include every category of the data, mandatory quarantine, routine surveillance, enhanced contact tracing?
Yeah, that's correct. So each person tested is included in the data. So whether it is enhanced surveillance activities that were held recently or what that is still going on, or it was the mandatory quarantine that we had some time past.
And so the positivity rate that is reported on the Ghana Health Service page, it would, from what you're saying, it will be total number of persons positive against individuals tested, not against samples that were taken.
No, against individuals tested.
Okay. I'm on the Ghana Health Service website now, and I'm looking at the data for mandatory quarantine. I'm seeing that the total number tested here is 2,022 against total number positive 115. Now, when the Ghana Health Service was explaining, they made us know that the number of persons who were quarantined were 1,030 in Accra and 11 in Tamale. So the 2022 number that is here, what does it represent, Dr. Boni?
So it represents those who were quarantined mandatorily, those who came in and they were quarantined in the hotels. And also in Tamale, those who were quarantined when they came in, from outside. So the positives that we are seeing there were the number of people who were quarantined and tested and turned out to be positive.
So that's the question, because the number 2022 has not been put out on any of the pages by the Ghana Health Service. In fact, if you look at the data, when they were looking at when 115 people tested positive, they wrote there, and it's on their page, that 1,030 people were quarantined and 115 people were found positive. So the number 2022, is it number of individuals or it's number of samples?
Number of individuals. I don't know what you mean by number of samples. One case, one sample, one individual is same. So if we have 10 people that we have to test, and we test the 10 people, we have tested 10 samples. Unless you are looking at the strategy that we use in testing, because of the upsurge in the number of cases that we had.
No, I'm not asking about the strategy, Doctor.
Okay.
I'm asking about the number 2022 here. Because
so these are the
when the president
who were tested.
Individuals
who were tested.
Great. When the president reported, he said 1,030. When the Ghana Health Service reported, he said 1,030. So I'm asking that 2022, where's the number from?
2022.
Yes. On the table, it says total number tested is 2022.
Okay, so now I'm getting where you are coming from. So if we have a positive case, we have to test so the person becomes negative. So for a positive case on day one, after a first week, we have to take the person's sample again and test. So we have one positive, but we have two tests. You understand?
Yes.
But what you have to know is that after the first week, some of the negatives that were tested on day one or the first week also became positive when we went in for the second, that is the second week when they were supposed to exit the hotels. Their samples were taken. So the number went up for the mandatory quarantined people. So that is what is adding up to the numbers that you are seeing. So if they say they quarantined 1,030 people.
1,030 in Accra.
Yes. And we are having numbers that are 2,000 and over. That means some others turned positive after the initial negative test.
I'm asking this question, Doc, because it seems to go against what Dr. Ampofu said yesterday, that the data provided to Ghana Health Service captured the individuals who were tested and their results. So that, for instance, the positivity rate here is 5.69% if you take 115 out of 2022. But you explained to us now that the 2022 is not individuals, it's number of tests taken.
Come again. I didn't get that point very clearly.
Yes. So what I'm saying here is that, okay, let me ask, the positivity rate of 5.69%, is it positive persons against persons tested? That's 1,030, or positive persons against samples taken? That's 2022.
Oh, so you mean the total number of samples that were taken?
Yes.
Yes. So I've not seen the positivity rate. I hardly look at Ghana Health Service and all that. But what I know, or what we are doing here, is that we test individuals and we give out the number of positives that we have to the health service, that's the Ghana Health Service. So I don't know the calculations that they have there, but what I know is that the individuals tested and the positives that we get from them is what is given to them. I'm not a statistician, and I don't know how they do their calculations or how they calculate the positivity rate and all that.
Great. So
what I know is that we give out the number of tests that we have done against the number of positives that we get from these tests to Ghana Health Service.
Okay, so Doc, we want to put a pin in it on this point, but I want us to get this clearly. What you're saying is that as per the data you presented to the Ghana Health Service, you tested 1,030 individuals, and 115 of them tested positive.
Yes.
Okay. Dr. Bonnie, we'll create your indulgence that we continue this conversation just around 7:45 so that we can touch on a few of the other issues. We want to understand a few things when it comes to pooling and what have you. And we were asking these questions because on the Ghana Health Service website, when they are talking about positivity rate by surveillance type, we are told that the total number tested is 2,022 and the total number positive is 115. Dr. Bonnie just educates us to tell us that they told the Ghana Health Service they tested 1,030 people and not 2022. We'll try and clear that up when we come back. You're live on the Super Morning Show on Joy 99.7 FM. The BBC News comes up shortly. Stay with us.
*442# is the new mobile banking formation in town.